Okay, go.
Alright, hi, I'm Brian.
I'm Joe.
I'm Keaton.
I'm Mark.
And I'm BJ. We did a presentation on cancer. What is cancer? Cancer is a multiplication of abnormal cells that occurs within a vital organ or tissue. Normal function will be impaired or halted with possible fatal results. There are also more than 100 known types of cancer. And then the two main major types of cancer are carcinoma, which when it originates in the epithelial tissue, and then there's sarcoma when it originates in the connective tissue. Cancer is caused by carcinogens, which are cancer-causing substances. And what happens is, when that carcinogen is affected, mutations occur, which is when the DNA gene is damaged or changed in such a way as to alter the genetic message carried by that gene. And more etiology, whatever causes cancer alters the cell's genetic makeup and the way it functions. This abnormal cell then divides, forming additional cancer cells. Over a period of time, this tumor or collection of abnormal cells tends to invade and ultimately take over normal tissue. Cancer can develop pretty much anywhere in the body and at any age. And cancer is usually caused by genetic damage that happens inside an individual cell. And cells that are affected are called malignant cells. Now, malignant cells divide much more rapidly than normal cells. And this abnormal growth destroys surrounding body tissues and may spread to other parts of the body in a process known as metastasis. Even though there's much more rapid growth in the abnormal cells, the main difference is that the cancer cells lose partial or all growth restraint, which means they'll keep growing, they'll just never stop.
Next we have carcinogens, and as he said before, that's just substances that cause cancer. And a few of those include ultraviolet light and radiation, which can be avoided by limiting sun exposure, avoiding tanning, and just wearing protection when you're going out in the sun, such as sunscreen. Also, some other ones are tobacco, alcohol, and a fatty diet, and that's just watching what you eat and making good choices. And then there's steroids, and also getting cancer is a combination of hereditary and environmental. Next, we have the athletic trainer's role in cancer, and some athletes, they can be stubborn and they don't always want to go to the doctor, or it's just more convenient during school or after school to go see the athletic trainer and ask for help or an opinion. And athletic trainers are involved with the recognition of cancer, and they do this during the pre-participation exam. And they do this through palpation, and they just check for tumors in major organs and lymph nodes. Other things that athletic trainers look for when an athlete could have cancer is rapid weight loss, blood pressure, and any abnormality in the heart, lungs. Also, they can use prior tests to see and compare results from earlier to now to make sure there's no huge differences. And then warning signs for cancer. Any changes in bowel or bladder habits could be a cause for concern. Also, sores that don't heal, unusual bleeding, thickening or lumps in the breast or elsewhere, and everyone can just use self-examination to check themselves regularly to make sure there's no abnormalities. Also, there's indigestion, difficulty swallowing, change in a wart or a mole, and nagging, coughing, or hoarseness.
Just like any other problem that we're going to face, I think the most important job as us being athletic trainers is education. And the athletic trainer should always educate the athlete to promote a healthy lifestyle. And education is the easiest way to prevent cancer. Self-examination techniques, like Brian just said, is breast cancer examination, the breast exam, and a testicular exam. And many athletes do not go to a regular physician and learn these techniques. Breast and testicular awareness months are a great time for the AT to teach these exams. So you really got to explain to your athletes, why they need to continually check themselves. Like Brian was talking about earlier with the carcinogens, smokeless tobacco is a huge problem in athletes nowadays. That statistic right there is really eye-opening. 41% of collegiate baseball players use smokeless tobacco, and you got to think that's a lot of people. And it's also popular amongst other athletes as well, like lacrosse and football and wrestling. Causes oral cancer lesions, cardiovascular disease in addition, and education, of course, is going to help prevent it more than anything else. And you can see by the beautiful picture we have in the bottom right-hand corner.
Alright, so sunscreen and diet. Education on sunscreen during athletic performance is key to prevent skin cancer. Exposure to UV rays is a risk factor for melanoma and non-melanoma skin cancer. All athletes outside can be exposed to UV even in snow sports, because when there's snow on the ground, the sun reflects, so it hits you even harder than if there's no snow on the ground. Beach and water sports increase chance of basal cell carcinoma, where skiing and snow sports increase squamous cell carcinoma. And a basal cell carcinoma is just, it occurs on the top layer of your skin, which is epidermis, and it can look pearly or waxy, white or light pink, flesh colored or brown. In some cases, skin might be raised or flat. It grows slowly and you feel no pain. But a squamous cell carcinoma, it occurs in the squamous layer of the skin. It's a non-melanoma skin cancer. The earliest form of squamous cell cancer is called Bowen's disease. It can't spread to other tissues around it. It occurs on the face, arms, hands, neck, or ears, but it can occur in other areas of the body. The main symptom is a growing bump that may have a rough, scaly surface and flat red patches, like the picture on the right. Changes to any existing wart, mole, or other skin lesions could be a sign of squamous cell cancer as well. AT should focus on 3 principles: avoidance in shade, textiles and hats, and sunscreen. Also, eating a well-balanced diet. Finnish Olympians had lower cancer rates due to a well-balanced diet, low sodium, lean meats, stuff like that. Steroid abuse, along with side effects such as roid rage, users can also suffer from cancer. Steroids are hard on the kidneys and liver. Common cancers include hepatocellular and prostatic carcinomas, liver and prostate. Wilms tumor occurs in the kidney, and renal carcinomas also occur in the kidney. AT should inform athletes about steroid abuse and recognize it amongst their athletes. Just keep your athletes aware of the risk and all that stuff.
So I'm going to be talking about athletes with cancer. The athletic trainer's relationship with the athlete is really important, and obviously every athlete's main goal is to participate in athletics. And the athletic trainer's job is not to be a cancer doctor, but they should be able to recognize, as we said before. And we found an interesting article that studied athletes from Finland who are world-class Olympians, particularly in track and field, and it measured their rates of cancer. And Mark mentioned before with the diet, but what they found was interesting was that hurdlers had sarcomas in their bone and soft tissue, because when you go over the hurdle, sometimes you hit your legs, and they said they didn't know why it happened, but that's exactly where the spot was, where they kept hitting. So athletic trainers should be aware of all injuries with their athletes, any abnormalities like that. So there's numerous ways to treat cancer, such as chemotherapy, surgery, radiation, or a combination of all of the above. It really depends on the what type of cancer it is. And this will not be given by the athletic trainers, and neither will any testing such as CAT scans or skin cells tests, or all those are done in laboratories by cancer doctors. The athlete's continuation on sport depends on the severity of cancer, location of the tumor, and response to treatment. Many athletes still want to continue their sport because this is the main thing, but it really depends on what type of cancer they have. Some tumors have a risk of getting ruptured, so they cannot do sports. Sometimes athletes will have really bad pain because tumors or any type of cancer cells are pressing down certain spots of their body, and sometimes they will even lose movement in certain parts of their body because of nerve damage or stuff like that. So recent research suggests that exercise can play a really important role in decreasing side effects of cancer. And the studies they did were among breast cancer patients who were undergoing chemotherapy, and they just had them walk on a treadmill every day, and they all said that they felt better after doing it, and they were less fatigued from the chemotherapy. Almost all athletes will be able to continue playing in their sports. It really depends on the type of cancer though. Some may not. I myself, as a child, had childhood cancer and I only have one kidney, so I'm going to use myself as an example. I can't play in any contact sports due to the risk of losing my other kidney, whereas most people have two, I only have one. So it really depends on the type of sport. Like I, for example, can't do anything that risk getting hit or anything like that. And even when I was had a tumor in my kidney, when that happened, they pulled me out of school just from the risk of getting hit by another kid if they didn't want it to rupture. So you have to be aware of all things like that. And the athletic trainer may use the NATA's recommendation for competing in athletics, which you'll see on the next slide. It's the chart in our book, and this has a ton of diseases, but there's also things such as like absence of one breast, testicle, kidney, liver, spleen, any abnormalities. This really goes to the contact sports or limited contact. And most athletes, like the reason that cancer is so different than any other disease such as like hypertension, diabetes, is that you can't regulate it. Diseases like that you could still continue in sports because you could either like watch your diet or just wear sunscreen or stuff like that, but with cancer, it's gonna be for a long time. So it really depends on severity and how the athlete feels. And that's our references.